Recording in. All right. So today I'm going to be talking about the library community pantry that I have at my branch. I appreciate that San Jose State University has asked me to present on this topic because it is one that is near and dear to my heart. I hope that you enjoy this session and that all the other sessions will help you think creatively about how you can be a supportive library. As I mentioned, this is helping customers meet basic needs through a library community pantry. My name is Rachel Myers, and I am a branch manager at Arundel County Public Library. I'm going to talk very briefly about our system and how we came to have a community pantry at our library, and then I'll get really down to the nuts and bolts of how that pantry works, the outcomes that we've seen, and how you can scale a pantry at your own location to be supportive of your customers. So Anne Arundel County Public Library is located in central Maryland. Annapolis, the state capital, is in our county, and we have 16 locations in our system. These numbers are a little bit older, but we had 301,000 visitors in fiscal year 21 and over 4 million checkouts. Most of our budget comes from the county of Anne Arundel County. My branch is located at Westfield Annapolis Mall. So we've been there for just over 6 years. And it was originally just a temporary location that we were trying out at the mall as a partnership with Westfield Annapolis Mall to see whether it was popular, whether customers responded to the library being at kind of a different location and different site and really in the way of people. It did work out, and we got continued funding for staff and location, and we're now the 6th largest branch in our county. We have mostly information staff because we do a ton of programming and outreach, of which the community pantry is counted in those numbers. And so because we also have a smaller collection, we have less need for circulation staff. So information staff really do it all at my location. I have 12 full-time equivalents and myself at our location. We have the highest visitor count in our county. So out of all the 16 branches, we see the most number of people, and we do the highest programming numbers, both in number of programs and attendance in our system. So we are constantly seeing new people, reintroducing the library to different people, and that gives us an opportunity to understand what their needs are and how the library can help meet them. So that's just a little bit about us. I want to talk a little bit also about how we learn about our community and what they need. So there's a number of different ways that we really try to dig into the data and not just rely on anecdotal stories or conversations with customers, although those things definitely come into play. But when implementing something like a large scale project of the community pantry size, we really wanted to back that up with information and make sure that we were making the right decisions because this is more work for the staff and different work. So we wanted to make sure that it was appropriate. We use branch observations, which I just mentioned. We've done a number of focus groups with our customers. So military families, we have a high percentage of those in our county. So we sat down with them to learn what they needed from the library and use that information. We've also had mall employee focus groups. So that helps us learn about our community, which really is the shopping center itself, and make decisions to support the people that work at the mall. We've also met with our neurodiverse families to understand what they need, and that information has gone into our decision-making process. I try to go to a lot of community meetings and learn what the community is interested in, what the needs of the community are, and what hot topics are being discussed at meetings led by the county executive, town hall meetings for the budget, or other resource meetings. And that can all factor into the way that we make decisions at the library. Our local development council, called the Community Foundation and the Partnership for Children, Youth, and Families, periodically puts together a quantitative data resource, a document called Poverty Amidst Plenty, that helps us identify gaps in services and resources all through our county. And finally, partnerships, really working with those community partners, understanding who are doing things that are valuable to our customers that we need to get the word out about, not trying to duplicate effort by what the library is focused on, and really coming together with our partners so that we can make decisions in concert to support everyone who lives in Anne Arundel County. As many of you did, we had some very tailored services during the pandemic response, but those were new things that the library hadn't been so involved in before. We were a location, because we were open, that could host food giveaways in the parking lots, staffed by partnerships from the local food bank, other local organizations, and library staff. We specifically leveraged that into mall and worker specific food giveaways, because we knew that everyone that was working with us at Westfield Annapolis Mall was also struggling through the pandemic and having to be at work in those early days. We wanted to be able to support them. We also regularly do mobile meal giveaways with the school system. And we did this during the pandemic closure as well. So we could give away library information, learn what people were needing, where the gaps were during those days of the pandemic response. Many of our branches in our county have little free pantries. So you are probably familiar with Little Free Libraries. So Little Free Pantries are a concept that an organization in our county called Caring Cupboard has brought to the libraries. You can see a picture of one here. This allows customers to take or leave non-perishable food in these Little Free Pantries to support anybody in the community. So once we moved away from those large-scale food giveaways at the library, these Caring Cupboards really have been supportive of so many people in our communities. We've learned a lot of things, like putting cans in the Little Free Pantry doesn't necessarily help someone that doesn't have a can opener. So we've been able to communicate with our customers who are all the time filling these Little Free Pantries about what things people really need. And they've been responsive to that as well, and very supportive of each other. We also, like many public library systems, have an evolving partnership with our Department of Social Services. A number of our branches, 5 or 6 branches, have regular social work hours staffed by someone from the Department of Social Services. So those social workers can help people apply for benefits, help find resources in the community, and also some of these social workers have a specific small pantry space at the branches that they only can access and give out supplies to people in need. So that has been a great partnership as well. This is something that we couldn't really staff from the library side. We didn't have extra positions to hire social workers, but we've found a way to partner with the Department of Social Services so that these are social service employees who work at the libraries, and it's helped them get out into the community more and be very accessible at library locations. So through all of these data collection points, hearing from the social workers, talking to our customers, we did hear that diaper need is very high in our county, as it is in the entire country. Diapers are really essential to a baby's health and development. Keeping kids clean, dry, and healthy is key to building a solid foundation so that kids can reach their full potential. We're very focused on kindergarten readiness at the library. but one of those ways that we can support kindergarten readiness is by having babies have what they need. 1 in 3 families struggle to provide clean diapers for their baby, which is a significant amount of people. These are Maryland's data points. You can find more information about your specific state on the National Diaper Bank website. And you can really drill down to see in your particular location some percentages about families that are living under the federal poverty limit and facing things like not being able to drop their kid off at daycare because they don't have enough supply of diapers at daycare, which then affects a caregiver's potential to go to work that day and really has ripple effects throughout the whole family. It's important to know that SNAP and WIC benefits cannot be used to purchase diapers. Likewise, they also cannot be used to purchase menstrual products. All of this information really provides context to the decision to implement a community pantry. We know that period products are not a luxury. They are a necessity for anyone who menstruates. And so because there is this stigma around discussing menstruation and the need for supplies, there aren't a lot of places where people can go to access these supplies. You can see that a recent study, and this is an ACLU study called The Unequal Price of Periods, showed that 2/3 of low-income women in St. Louis could not afford menstrual products during the previous year and were using cloth, rags, diapers, or paper as a substitute. Shelters and emergency response centers often don't provide menstrual products, and a lot of correctional facilities do not either. Some schools are starting to provide products, but that only provides products for the children or young adults who are going to school. So you can see that there's a gap here as well. There's a lot of work to do around diaper and menstrual product need. So we really see this at Anne Arundel County Public Library as an equity issue. Not having access to period products and diapers can extend to so many other aspects of people's life. I talked about that ripple effect when you might not be able to take your child to daycare because they don't have enough store of diapers, but there really can be lasting emotional and medical impacts from not having access to these products. Students might miss school, adults might miss work, and when your basic needs are not being met, and diapers and menstrual products are basic needs, you really can't fully engage in other opportunities like school, work, fun things, and especially also library resources. So when we're thinking about lifelong learning, kindergarten readiness, is our expectation that families can engage with library resources, go to library programs, take advantage of all the things we have if they don't have those basic needs met? That's not necessarily a realistic goal for every family. So how can we bridge that gap as a library so that they can take advantage of the things that are available to them? So we decided to open a community pantry at Discoveries. I talked about us having a small temporary space. Obviously, in that 3,000 square foot space, there was not room for a community pantry. But when I was a part of designing a larger 13,000 square foot space that we're in now, I set aside a closet, hopefully for a pantry of some type. So pre-pandemic, we opened the new space in February 2020. At that point, we were talking to the Anne Arundel County Food Bank and thinking about ways that we could make this a food pantry. We all know how much our lives changed at that point, and we really had to think about the ability of our partners to engage in something at the library, and library capacity. So at that point, we made a shift from the food pantry to another resource to help the community. And then our plan became diapers and menstrual products. We worked with the Container Store that was opening at the library. At the mall. They do community service projects when they open new stores, and they outfitted us with the shelves that you can see in this picture. And we kind of started from scratch. We did a donation drive and went from there. And the pantry opened on July 17th, 2021. So we're coming up on our third anniversary. We've gone through a lot of iterations, tweaking things at the pantry as we've gone. But we currently serve about 200 families a month. We are open on the first Saturday of the month from 10 to noon, and the first Tuesday of the month from 6 to 7 p.m. We were able to engage a lot of English as a second language families through the pantry. Historically, this has been a population in our county that has been hard to engage with library resources. But through the pantry and bringing them to the pantry for this resource, my staff, who are rock stars and speak Spanish, have been able to introduce the library to so many families because they are coming to access pantry resources. In Maryland, you can get a library card if you just live, work, or go to school in the state of Maryland. All we use for tracking at the pantry is a library card. So we've seen people from 51 different zip codes access pantry supplies. And last year, we had 2,201 visits to the pantry, where we distributed over 4,000 packs of diapers and 1,634 packs of menstrual products and incontinence supplies. We started out very succinctly and concisely and handing out, distributing diapers and menstrual products. We quickly expanded that. We give diapers, wipes, diaper cream, lotion, shampoo, nursing supplies, menstrual products, incontinence supplies. So all of these things are hitting different populations in our county. I see a comment there that incontinence supplies are a huge need and very few places distribute them, which is so true. We didn't necessarily set out to distribute those, but we heard from a lot of our senior customers that that was a need that they were having. And so we are able to also support people that aren't coming in with children, but adults who also are in need and maybe just need shampoo or a pack of adult diapers. I'm going to definitely talk more. I know I have only 12 minutes left. So the outcomes we really wanted to see and do see are creating a more improved trust relationship between our customers and the library. A lot of customers, as we know, already at the desk share very private or important things to them with the librarians. Through this interaction at the pantry distribution, people also are being very vulnerable and coming to trust the library in a different light. We've hopefully improved the health and dignity of those in need. Our pantry is very low barrier, as opposed to some of those in our community where you have to provide a lot of documentation in order to take advantage of the things that are being distributed. We really want you to get a library card. Hopefully you can do that. If you can't, it's not a barrier to getting supplies. But we'll figure out a way to make that work for you. It also allows family to focus on other priorities and connecting customers to other resources in our community. We've extended the pantry in many ways through the life of the pantry. Of course, we distributed rapid COVID tests en masse. We are still distributing COVID tests at our libraries. We have a take a coat, leave a coat rack during the winter, which functions similarly to a little free library, little free pantry, where we just have a rack at the library. And winter wear that maybe you've grown out of or you don't need anymore, you can bring and people can take that. We were able to create summer slide bags for our pantry families, which included flashcards, activity books, free books, of course, from the library. And each month during pantry distribution, we have a different partner come and table that provides a resource to our pantry families. So it might be someone from the state helping people sign up for SNAP. We've had pro bono lawyers do consultations. You can sign up for a 15-minute appointment during pantry time. We have had our local immigration organization come and give out information. It's different every month, and we see this as a way to both give a voice to these organizations in our community that might not have a public place that people can come, but they can come to the library and learn more about what they offer. So that comes every month.
Great. Thank you, Rachel. There was a quick question. Are unhoused individuals able to get a library card to access this
Yes.
community pantry? Okay, perfect.
Yeah, we have a very low requirement to getting a library card. So you just have to have something with your name on it, and we'll figure out a way to get you a library card. We don't send anything anymore. We used to be very much more concerned about your address and matching that with your name and all of that. But no, we definitely help people get a library card. But like I mentioned too, if you don't have a library card and you come and need to get something from the pantry, we'll make that happen. So we have these two distribution days, but then people can come any other time technically. Since we're there all the time and the pantry is accessible, you can come and pick up stuff if you need it. We have usually 3 staff members staffing the pantry, and we have volunteers that help us kind of behind the scenes filling bags if we need it, and they or stock things during the week if we do a big donation drive. The volunteers really pitch in definitely with that. The need in our county is great, as it is around the country, because these federal benefit programs do not support buying menstrual products and diapers. The need continues. One of the ways I see there was a question about funding, so let's get to the supplies part, and then I'll go back to the other slides. So this, I would say the pantry is 95% funded by donations from our community. We do a couple big donation drives throughout the year. You can drop off anytime at any branch location, so 16 locations in our county. So if you want to donate stuff, you can drop off things. We take open packs of diapers and repackage them. So if your child grows out of a size and you had bought a bunch of them, you can donate them to the pantry. We, running out this month, we had a $500 American Rescue Plan Act grant from our county. So we've had that since the start of the pantry. That $500 doesn't go a long way when you talk about buying diapers that cost $40 box. So that really supplements all the things that we get from donations. We've have a ton of partnerships with places in our community. There's a lot of community service organizations looking for things to do. So our local junior league, the Maryland or Anne Arundel Commission for Women. We have a leadership Anne Arundel group, all of these groups that have a lot of members in our community have been essential in doing drives for us. We have both the mall and our local bookstore. When the three of us do programs together, they donate a part of the ticket sales to big author events, to the pantry. There's a lot of different streams of donations from, we have a lot of sweet customers that every 3 weeks when they come to the library, they bring 1 pack of diapers, to really big organizations that are doing kind of massive drives. People, once the word has gotten out into the community, people are very excited to help if they can. Helping families and children especially is I would say like an easy sell to people who want to give stuff. But we have really found that our community is really willing to help. Summertime is bad for donations. So last summer we had a really hard July and August where we were very low on things. But we were able to do some social media, put the call out, and people really stepped up and helped us fill the pantry. It is an issue of where do you put all these things. So you have to definitely take that into consideration. You can do mini diaper giveaways. Maybe you have an event. Some of our branches do a community baby shower. So you could do a mini diaper giveaway where you're not trying to hold supplies every month for hundreds of people, but you could do starting people off in your community with size 1 diapers. I mentioned the social worker facilitated pantries. That's a great way too. Our library system was able to get into our budget last year, free menstrual products in the customer bathrooms at all of our branches. That also has been an important outreach. So you can think about where those gaps are and start small, and think about ways that you can meet them. I wanted to mention too that there's a lot of work out there around comfort cabinets, resource cabinets at libraries. So you can think about ways that you can maybe make a pantry that's self-serve, where you have menstrual products and hygiene supplies, and maybe diapers or maybe not, whatever the really need in your community is. All right, I'm right at the end. We made period packs for our local women's shelter. We made homeless packs for the winter relief in our community because we had all these different donations. And all of those things have been very gratifying ways to extend the pantry beyond our doors. So this was a really quick presentation about our community pantry. We are working on this every day and thinking about ways that we can connect our customers to not only to books, but to the resources and to each other, that and in ways that will help them meet their basic needs so that they can then hopefully take part in more of the library resources. You can start small, or you can just be a little bit risky like I was and just be like, well, we got this whole closet, let's just do the whole thing. There's a lot of questions regularly about like, why is this a library thing to do? And really it's because of that connection and helping our customers get what they need. Some people need books, some people need diapers. And so let's help them get what they need. All right, I'm right at 4:30. I know you have to go to other presentations. Feel free to email me, rmyers@aacpl.net, if you want more information or you want to chat about things. I appreciate everybody being here today, and I hope that you think about ways that this might work for you.
Fantastic presentation. Thank you
Yeah.
so much,
I'll
Rachel.
put my email in the chat.
Perfect.
Oops. Thank you all.